The 5 types of viral hepatitis. Hepatitis A. Hepatitis A is caused by the hepatitis A virus. It is spread through contact with people infected with the disease, their fluids or waste. It affects your liver and usually causes mild illness, but can sometimes be severe and result in liver failure. Adults are more likely to have severe symptoms than children. The hepatitis A vaccine does not protect you from hepatitis B or hepatitis C. If you've had hepatitis A before, you won't get it again, but you can still get hepatitis B or C. Symptoms. Some people who have hepatitis A have few or no symptoms, especially children under the age of 5. In adolescents and adults, hepatitis A symptoms include fever, nausea, pain in the stomach area, dark urine, jaundice, yellow skin and eyes. Symptoms usually start about 2 to 4 weeks after catching hepatitis A. Symptoms can last for several weeks. Most people with hepatitis A fully recover. Who is at risk? People from, or visiting, developing countries that have less access to clean water or sanitation, are more at risk of getting hepatitis A. Outbreaks of hepatitis A can also sometimes occur at childcare centers, in people who have eaten contaminated food, in people who inject. Hepatitis A can affect people at any age. How it spreads. Hepatitis A spreads when people come into direct contact with infected food, drink, feces. People. If you have hepatitis A, you can help stop the disease spreading by staying away from childcare, school, work or other places where you could spread the infection. Your doctor will tell you when you are no longer infectious. Washing your hands often. Washing, preparing and cooking foods properly. Not sharing towels or eating or drinking utensils with others. Prevention. Hepatitis A vaccines protect you from getting infected and prevent serious disease. Your doctor may suggest you be vaccinated if you're planning to visit a region with where hepatitis A is common. Diagnosis. Your doctor can diagnose hepatitis A by checking your symptoms, asking if you have been in contact with someone who has hepatitis A, asking if you have recently traveled to a country where hepatitis A is more common, performing a blood test. Treatment. There is no specific treatment for hepatitis A. You can relieve symptoms by getting plenty of rest, drinking plenty of water, avoiding alcohol, and medicines that affect your liver. Hepatitis B. Hepatitis B, HBV, is a liver disease caused by the hepatitis B virus. Most hepatitis B infections clear up within 1 to 2 months without treatment. When the infection lasts more than 6 months, it can develop into chronic hepatitis B, which can lead to chronic inflammation of the liver, cirrhosis, scarring of the liver cancer, and/or liver failure. The hepatitis B virus is spread through contact with body fluids of an infected person, such as blood, semen, vaginal fluids, and saliva. Unlike the hepatitis A virus, hepatitis B virus is not spread through contaminated food or water. Hepatitis B can be passed on through needle sharing/accidental needle sticks, but children with hepatitis B more likely contracted it through being born to a mother who has hepatitis B, living in the same house with someone who is infected with hepatitis B, and sharing items such as toothbrushes or razor blades, receiving multiple transfusions of blood or blood products, as hemophilia, being bitten so that the skin is broken by someone whose saliva contains the hepatitis B virus, being a hemodialysis patient. Symptoms. The hepatitis B virus mainly affects the liver, and enters the liver cells, called hepatocytes, when in the body. Reproduction of the virus causes death of these cells. The sudden death of a large number of liver cells can cause liver damage or even liver failure. In most children with hepatitis B, this does not happen. Instead, the virus multiplies slowly and persists in the body, causing slow but progressive liver damage. This state is known as the chronic carrier state. Even though the person has hepatitis B in his or her liver and blood, there are no signs of disease. A chronic carrier can still pass the disease on to others, even if he or she has no symptoms. Most children who acquire the infection at birth or soon after become chronic carriers. In contrast, adults who get the infection have an acute illness, followed by clearance of the virus. Symptoms usually appear within 25 to 180 days following exposure to HBV. The most common symptoms are yellowing skin and eyes, jaundice, fatigue that lasts for weeks or even months, abdominal pain in the area of the liver, upper right side, loss of appetite, nausea, vomiting, joint pain, low-grade fever, dark urine, widespread itching, rash. Diagnosis: Hepatitis B is diagnosed with blood tests, which are also used to monitor its effects on the liver. For chronic cases, a liver biopsy may be needed. A biopsy is the removal of a sample of liver tissue for testing. Vaccinations: It is important for children to receive hepatitis B vaccinations. This consists of 3 injections over a 6-month period. Protection is not complete without all 3 injections. Hepatitis C. Hepatitis C is a form of viral hepatitis which, like other forms of viral hepatitis, causes inflammation of the liver and can damage the liver cells. The hepatitis C virus generally produces a mild illness with no or subtle symptoms in its early stages. However, it is much more likely than other hepatitis infections to go on to cause chronic liver disease. There are genetically different strains, genotypes, of the hepatitis C virus which influence the way the virus replicates itself in the body, the course of the disease and the response of the disease to treatment. There is currently no vaccine against hepatitis C. Transmission: The hepatitis C virus is transmitted through close contact with the blood of an infected person. Blood transfusions have been a significant source of hepatitis C infection in the past, but since 1992 all blood donated in New Zealand has been screened for hepatitis viruses. Transmission can occur through intravenous drug use. There is a small risk that hepatitis C can be spread through sexual intercourse. In many cases of hepatitis C, it is not possible to trace the source of the infection. Symptoms: Acute hepatitis C symptoms. Only a small proportion of people infected with the hepatitis C virus will get sick with acute, short-term, hepatitis C. Symptoms of acute hepatitis C include joint pain, loss of appetite, nausea, tiredness, fever, abdominal pain and jaundice, yellowing of the skin and eyes. Acute hepatitis C is usually a mild illness from which most people recover within 4 to 8 weeks. Chronic hepatitis C symptoms. Chronic carriers of hepatitis C are at risk of chronic, long-term, liver disease, which causes progressive damage to the liver. Early symptoms include mild fatigue, a feeling of being vaguely unwell, and alcohol intolerance. Serious complications of chronic liver disease, such as fibrosis and cirrhosis, scarring of the liver, may not become apparent until 20 to 50 years after infection with the virus. People with cirrhosis may go on to develop liver failure or liver cancer. People with chronic liver disease are also at risk of developing a combination of symptoms that include joint pain, muscle weakness and skin irritations. The kidneys and brain may also be affected. The disease tends to progress more rapidly in chronic carriers who are male, those who are over 40 years of age, and those who drink alcohol. Diagnosis: Hepatitis C may be suspected if vague symptoms of being unwell are experienced in association with abnormal liver function tests or a swollen liver. A simple blood test for the presence of hepatitis C antibodies determines whether a patient has been exposed to the virus. A further blood test can confirm the presence of the actual virus in the blood. If a diagnosis of hepatitis C is made, further blood tests to check liver function will be taken and a fibro scan to check for liver damage in the form of fibrosis or cirrhosis may be recommended. The fibro scan is a pain-free alternative to liver biopsy that uses ultrasound to measure the degree of scarring of the liver. Treatment: Hepatitis C is treated with antiviral medications with the objective of having no hepatitis C virus detected in the body after completion of a 12-week course of treatment. The type of antiviral medication used will depend on hepatitis C genotype, degree of liver damage, previous treatment for hepatitis C. Until recently, treatment for chronic hepatitis C usually involved taking two main medicines: pegylated interferon, a medication given by injection that encourages the immune system to attack the virus; ribavirin, an antiviral medication that stops the virus replicating. Side effects of treatment that involves pegylated interferon, flu-like symptoms, headache, fatigue, etc., are quite common. The new tablet hours, however, have fewer side effects and are generally better tolerated by most people. As well as treatment with medications, it is important for chronic carriers to make healthy lifestyle choices. This includes maintaining a healthy diet, especially avoiding fatty foods, avoiding alcohol, avoiding taking any unnecessary medications, maintaining a good level of physical fitness. Surgery is sometimes necessary to treat complications of liver disease, and some patients with advanced liver disease may be candidates for liver transplantation. Prevention. Currently there is no vaccine against the hepatitis C virus. So, to avoid the spread of the disease and other blood-borne illnesses, people should cover cuts and scratches with appropriate dressings, hygienically dispose of blood-stained items such as bandages and sanitary napkins, avoid sharing personal items that may be contaminated with blood, such as toothbrushes and razors, avoid sharing drug-injecting equipment. Hepatitis D, which people sometimes call Delta hepatitis, is a viral infection that occurs due to the hepatitis D virus, HDV, and causes inflammation of the liver. According to the World Health Organization, WHO, 5% of people across the world with chronic hepatitis B also have hepatitis D. Causes. People get hepatitis D through contact with the virus in the bodily fluids of infected people. However, a person can only get hepatitis D if they already have hepatitis B, because HDV uses the hepatitis B virus to replicate. Situations in which a person may come into contact with an infected person's bodily fluids include sharing needles, having blood-to-blood contact during childbirth, using unsterilized medical or drug equipment. It is not possible to get hepatitis D through food or drink. People who are more at risk of getting hepatitis D include those who have hepatitis B, have not received the hepatitis B vaccine, inject drugs. Symptoms. People may develop acute hepatitis D, chronic hepatitis D, or both. People with acute hepatitis D may have the following symptoms: fatigue, loss of appetite, pain in the upper right abdomen, over the liver, dark urine, nausea, vomiting, yellowing of the skin and whites of the eye. Diagnosis. A doctor will carry out a physical examination and take a full medical history before making a hepatitis D diagnosis. They will take into account any symptoms that people are experiencing and any risk factors that the person has for hepatitis D. A doctor may look for signs of liver damage, such as swelling in the abdomen or other parts of the body. A blood test can show whether someone has hepatitis D. A doctor may also carry out tests to check the health of the liver. These tests may include an ultrasound, a biopsy, or both. Treatment. There is currently no cure for hepatitis D, but treatment can help people manage the condition. For people with chronic hepatitis D, a doctor will often prescribe a medicine called pegylated interferon alpha, which reduces the risk of the condition worsening. People will usually take this for at least 48 weeks. People with hepatitis D may also require treatment for hepatitis B. The treatment for hepatitis B includes antiviral medication and immune-modulating drugs. These help the immune system fight off the virus. Hepatitis C. Hepatitis C is an infectious virus that attacks the liver, where it causes inflammation and damage. In certain people, this could lead to serious complications over time. Treatment is generally straightforward, and many people do not need medical attention to treat hepatitis C. Causes. The hepatitis E virus occurs most often when people consume food or drink that is contaminated with feces. Hepatitis C mainly spreads through contaminated water in areas with poor water quality. Fecal matter from humans or farm animals may contaminate the water, which may then carry the virus. This is more common in developing countries with poor water quality and control, especially in highly populated areas. Traveling to or living in these areas may increase the risk of getting the infection. Symptoms. The symptoms of hepatitis C can vary. Some people experience no symptoms at all or symptoms so mild that they hardly notice. Others, however, can experience a few different symptoms, usually appearing 15 to 60 days after exposure to the virus. Possible symptoms of hepatitis C include tiredness and general fatigue, poor appetite, fever, nausea, vomiting, jaundice, or yellowing of the skin and whites of the eyes, pain in the upper abdomen, specifically over the liver, dark urine. The symptoms tend to disappear as the infection clears. Diagnosis. There is currently no formally approved test to diagnose hepatitis C. To properly diagnose hepatitis C, doctors must rely on tests to identify the antibodies that fight against the virus. They will also check the blood for other types of hepatitis, including hepatitis A, B, and C. If a person tests negative for these types of hepatitis and also has the antibodies that fight hepatitis C in their body, doctors may determine that they have the infection. Treatment. Hepatitis E does not tend to require medical treatment, and the body clears the infection without outside help. However, doctors may recommend some tips to support the body while it is recovering from the infection. These include eating a varied, balanced diet, drinking plenty of liquids, especially water, resting, avoiding things that irritate the liver, such as alcohol. Doctors may also ask about any medications that a person is taking. Some may cause damage to the liver. Doctors might look at medications and see whether there is a way to limit or eliminate them while a person recovers from the infection. The same applies to many supplements and vitamins. It is also important for people to see their doctor regularly as the body heals. The doctor may look for any physical changes or track treatment progression, using blood tests to determine whether the body can handle the infection. Prevention. Preventing hepatitis C is the best way to avoid the infection and its possible complications. When traveling to developing countries or overcrowded areas with unclean water, be sure to only drink purified water. The easiest way to do this is to drink bottled water at all times. The same applies to all water use in these areas. Use bottled water for everything from brushing the teeth to washing fruits and vegetables. Preventing the spread of the virus is also important. While it is uncommon to spread the virus among people, anyone with the virus should take care to follow hygiene tips.